नमस्कार, मी नीता देव. बार्शी टुडे यूट्यूब चॅनलमध्ये आपले स्वागत.
रूरल अँड रिसर्च सोसायटीज नर्गिस मेमोरियल कॅन्सर हॉस्पिटल बार्शी सर्व मान्यवरांचं स्वागत करते. आपण एकदा जोरदार टाळ्या जीवन गौरव पुरस्कृत असे डॉक्टर शंकर नारायण आपल्याला भेट देण्यासाठी इथे या कॅन्सर हॉस्पिटलला आलेले आहे, ज्यांनी खूप आपल्या हॉस्पिटलसाठी योगदान दिलेलं आहे. लाईफ टाईम अचीवमेंट अवॉर्ड विनर डॉक्टर शंकर नारायण, IRC and WHO senior scientist, Dr.Malavi ma'am, principal investigator of our project, Sri Anil Kumar, project officer, America, Kerala, chairman and executive president of our society, Mr. Dilip Sopal sir, secretary of our society, Mr. Satyanarayan Kumar, treasurer of our society, Mr. Shukla sir, chief project, Mr. Chauhan sir, administrative officer, Mr. Paranskar sir, medical coordinator of the project, Mr. Anand sir. Welcome to all of you. I request to Chauhan sir to introduce Mr. Senkarnarayan.
Dr. Senkarnarayan is well known to everybody, whosoever is present here. And it's not a new thing to introduce him. But his involvement is necessary to tell all of you. His involvement, that was since beginning. In the year 1919, the cervical cancer prevention program was started. He was instrumental in getting the funds for this project, and right from the beginning, he is a guide for us. He has guided us, otherwise it was not possible for us to execute this program, and because it is a totally scientific program. But in the beginning, when he offered this, that you accept this. Before that, one project was given to Mrs. Kasturi Jayant, that was impact of education on cancer control. But eventually it was given to Ashwini Hospital by Mrs. Jayant, and Mrs. Jayant was here that time. She was working as a PI to the rural cancer registry, which is the first in India, first rural cancer registry in India by ICMR. She was at that time. So the results of that impact of education project, which we executed in Marha and Karmada, were fantastic, very good, and those results with IR. So when the question came that where to give this CCPP program, he insisted on that it should be given to Barshi. Barshi Center was a full-fledged cancer hospital. It was having all facilities that time, even 20 years back. It has a radiotherapy unit, it has a surgery, it has other wings also. So it was a well-set center. So it was selected for executing this globally scientific program. And whatever success we have achieved, in fact, it was given only for 5 years. But since then, continuously we are getting the funds, and continuously we are giving the results. And all the results have been highly acclaimed, highly appreciated in the scientific community of the world. So this is his introduction, that he was all the time involved with Barshi. So many times, I have heard so many times, sir, what is in Barshi? Why do you love Barshi? Why do you prefer Barshi? Then in conferences the questions have come that why you love so much to Barshi? Why? Always, whenever he has come to Barshi, his bags had less clothes and more equipment. All the time he is bringing some equipment from IRC. This is to be used, this is to be used. This is a kind of thing that his involvement was. And last month he was to come, but unfortunately Dr. Malavi had an accident and could not come. Now he has come. He is not feeling well, in fact, but he came over here, and we are happy that he has been given a lifetime achievement award by an organization which is called Federation of Obstetrics and Gynecological Society of India. It is an international organization which is working in the field of gynecology. And just 2 months back, they have given him Lifetime Achievement Award for his contribution, magnanimous contribution towards the work. I would like to read the citation that was given to him that will reveal a lot of facts. It is an honor to felicitate Dr. Rangaswamy Senkarnarayan. In fact, his name is Rangaswamy Senkarnarayan, but he is popularly known as a Dr. Shankar. Everywhere in the world he is known as a Dr. Shankar. With the prestigious Lifetime Achievement Award for his outstanding contribution in the field of oncology, he did his MD, radiology and clinical oncology from the University of Kerala, India, followed by postdoctoral training in San Francisco 1984, Pittsburgh 1987-88, and Cambridge in 1988-89. He has worked in collaboration with several colleagues, several national and international organizations, which include Regional Cancer Center Trivandrum in India, 1980-93. He is the International Agency for Research on Cancer of the World Health Organization from Lyon, France, with par excellence in his field. He has been the Special Advisor on Cancer Control, Head of the Cancer Early Detection and Prevention Section, IARC, and Head of the Screening Group until his formal retirement in December 2017. His glorious journey doesn't stop here. Presently, he is Senior Visiting Scientist, International Agency for Research on Cancer, WHO, Lyon, France, Director, Preventive Oncology, Harkinose Healthcare India. He has a strong commitment to research, training program development, cancer healthcare delivery, and technical assistance in the early detection and control of cancer, particularly breast, cervical, colorectal, and oral cancers. His expertise includes studies assessing cancer burden and planning, implementation, and evaluation of cancer screening in control programs and cancer information systems. He has published more than 200 manuscripts in international peer-reviewed journals and widely traveled in more than 100 countries to make his tireless efforts in the field of cancer prevention. This is his citation given at the time of when the Lifetime Achievement was awarded to him. Now today he is here, and I request Sopal please felicitate him. Working in Tata Hospital, and right from the beginning she is involved in this project. And whatever the quality of this laboratory is maintained, she is a key person to maintain all that. I was privileged and proud to tell everybody that this is only the laboratory which is approved accreditation for cyto-oncology after Bombay. There is no center which is approved for cytology, oncology, especially oncocytology. And it is approved and in Maharashtra. And she has taken efforts to maintain that quality, to do the, because it requires a lot of paperwork and quality control, that she has exercised all those things to bring the name for NDMCH and for the project. She is a key person, I request.
सुपर
So, I request. Please,
Project manager for Amlikai cervical cancer prevention program and for the cervical vaccination program is here. So I request our president to facilitate the Anil Kumar. Please.
come forward.
थोडं साईड घ्या कॅमेरा. यानंतर पुढचे 2 सत्कार आहेत ते कस्तुरी जयंत मॅम यांच्याकडून घेणार आहोत आपण. त्या 90च्या पुढच्या असल्यामुळे ते उपस्थित राहू शकले नाहीत काही कारणास्तव. सर्व शिबिरांच्या तळमळीने नियोजन करणाऱ्या साथीरोग प्रतिबंधक शास्त्रज्ञ अशा कस्तुरी जयंत मॅम 1987 साली या सोसायटीमध्ये ग्रामीण कर्करोग नोंदणी प्रकल्प, भारतातील हा ग्रामीण भागातील पहिला प्रकल्प आहे. याचं मोलाचं योगदान आणि मार्गदर्शन त्यांनी केलेलं आहे. राष्ट्रीय आंतरराष्ट्रीय सन्मानित कस्तुरी जयंत, कॅन्सर हॉस्पिटलच्या प्रोत्साहन, योगदान, मार्गदर्शन हे सगळं सोपल साहेबांमुळे झालेलं आहे आणि सोपल साहेबांनी दिलेलं आहे. त्यानंतर ते देत आहे, त्यामुळे सोपल साहेबांचा सत्कारही त्यांच्याकडून होणार आहे, तो त्यांनी स्वीकारावा. त्यांनी विनंती केल्यामुळे सोपल साहेबांचा सत्कार त्यांना करावा असं वाटतं. त्या खरं तर उपस्थित स्वतः राहणार होत्या. बार्शीचे जागतिक स्तरावर एक उत्तम कर्करोग हॉस्पिटल व्हावे आणि नवीन योजना उपलब्ध व्हाव्यात यासाठी अत्यंत प्रामाणिकपणे आणि प्रेमाने आपले योगदान देणारे डॉक्टर शंकर नारायण यांचे कौतुक करण्यासाठी हा स्पेशल सत्कार आहे. खरं तर त्या स्वतः इथे यांचाही सत्कार करण्यासाठी उपस्थित राहू शकले नाहीये. सरांनी सत्कार स्वीकारावा.
ज्यावेळेस त्या 1987 साली त्यांचा हा प्रवास सुरू झाला आणि सोपल साहेब 1985 साली पहिल्यांदा आमदार झाले आणि त्यांचं सिद्धेश्वर ह्या ट्रेननं येणं जाणं सुरू झालं बार्शीला आणि मॅडमचंही 87 साली बार्शीकडे येणं सुरू झालं. त्या ट्रेनमधनं येत असताना कधी कधी मॅडमला गाडी नसायची कुलवाडीपासून पिकअप करायला, तर सोपल साहेब त्यांच्यासोबत असल्यामुळे त्यांना तिथून गाडी इथपर्यंत पोच करायला वगैरे द्यायचे. असं त्यांचं एक रिलेशन तिथं मेंटेन झालेलं होतं मॅडमचं. नेहमीच मॅडमनी हाय रिगार्ड सोपल साहेबांविषयी सांगितलं. त्याच्यानंतर एकदा असं झालं की मॅडमला मध्ये आम्ही म्हटलं मॅडम तुम्ही बार्शीला काय येत नाही, तर त्यांनी सांगितलं की अरे तू आता म्हणतोयस, मला सोपल साहेबांनी फार वर्षापूर्वी एक ऑफर दिली होती की मॅडम तुम्ही इथं या राहिला आणि तुमच्या सगळ्या गोष्टींची काळजी आम्ही घेऊ. तर बार्शीविषयी त्यांची का अटॅचमेंट आहे ह्याचं कोड आम्हाला आता उलगडलं की सोपल साहेबांसारखा व्यक्ती इथं असेल आणि तो 4-5 वर्षापूर्वीच मॅडमला ऑफर देतो की मॅडम तुम्ही या बिंदास्त इथं आणि प्रत्येक गोष्टीची आम्ही तुमची काळजी घेऊ. तर असं एक व्यक्तिमत्व त्यामुळे मॅडमच्या मनात नेहमी होतं की प्रत्यक्ष आपण यावं, सोपल साहेबांना भेटावं आणि त्यांच्याशी चर्चा करावी. आणि त्यांचा नेहमीच हाय रिगार्ड साहेबांसाठी राहिलेला आहे की 1987 पासून काम करत असताना त्यांनी दिलेलं जे सहकार्य आहे त्याच्याबद्दल त्यांनी नेहमीच अप्रिशिएशन दिलेलं आहे. आणि आजचा योग त्या निमित्तानं आला आणि आज साहेबांनी त्यांच्या वतीनं सत्कार स्वीकारलेला आहे. आणि दुसरा सत्कार जो आपण दिलेला आहे की मॅडमच्या वतीनं डॉक्टर शंकरनारायण साहेब की त्यांचंही योगदान आपल्या हॉस्पिटलच्या आणि ह्याच्या वाढीसाठी जे लागलेलं आहे की 95 सालापासून त्यांचा आपल्याशी संपर्क आलेला आहे आणि त्यांच्या माध्यमातून इंटरनॅशनल एजन्सी फॉर रिसर्च ऑन कॅन्सर WHO ची जागतिक कर्करोग संशोधन संस्था आहे ह्याच्याशी आपला संपर्क आहे आणि त्या माध्यमातून आपल्याला एक एक प्रोजेक्ट मिळत गेले. CCP प्रोजेक्ट झाला की सगळ्यात मोठा जो आता आपण प्रोजेक्ट रन करतोय तो म्हणजे सर्वायकल कॅन्सर व्हॅक्सिनेशन प्रोग्राम, जो की 2009 साली सुरू झाला होता. तोही 5 वर्षासाठी आला होता. पण आता सगळ्या जगाचं लक्ष आपल्या बार्शी सेंटरकडे ह्याच्यासाठी आहे की महिलांमध्ये जो गर्भाशय पिशवीचा कॅन्सर होतोय तो प्रतिबंध करण्यासाठी एक लसीची मात्रा जर दिली तर तो नक्कीच प्रिव्हेंट आपण करू शकू आणि जगामध्ये सगळ्यांना ही पॉलिसी जाईल. ह्या सगळ्या निकालासाठी आज बार्शी सेंटर त्याच्यामध्ये इन्व्हॉल्व आहे. 9 सेंटरपैकी बार्शी सेंटरला सगळ्यात जास्त वाटा त्यातला दिलेला आहे की 40% मुली ज्या आहेत त्या आपल्या सेंटरला आहेत आणि सगळ्या स्टडीचा कंप्लायन्स मोर दॅन 90% आपण देतोय. त्याच्यामुळं आपल्याला ह्या 5 वर्षाचा एक्सटेन्शन मिळालेला आहे आणि काल बोलत असताना शंकरराव सरांनी सांगितलं की आणखी 5 वर्षाचं म्हणजे 2026 आणि त्याच्या पुढे म्हणजे 2001. तर ह्या सगळ्या टीम वर्कचं आणि आपल्याला जे सहकार्य सगळ्यांच्या वतीनं लाभतंय आदरणीय सोपल साहेबांचं, आपले ट्रेझरर जे आहेत शुक्ला साहेबांचं आणि सगळ्यात महत्त्वाचं म्हणजे की झंवर साहेबांचं नेहमीच ते आपल्याला प्रोजेक्टच्या कामासाठी मदत करत असतात. ते जरी वरून कडक वाटत असले तरी फणसासारखं त्यांचं काम आहे, अजून अतिशय सॉफ्ट आणि आहे त्यांचं बोलणं. तर ह्या प्रोजेक्टच्या कामाशी या सगळ्यांचं नेहमीच आपल्याला सहकार्य राहिलेलं आहे आणि सगळ्यात प्राऊड आणि महत्त्वाची गोष्ट की आता हा येणारा प्रोजेक्ट आपल्याला एका चांगल्या दिशेने घेऊन जाणार आहे असं आहे. I signed in 1985 as an MLA and he used to travel by Siddheshwar Express during that days. And while accompanying when there was no any facilities available to travel from Kulwadi Barshi, he used to come with the delivery supply and provide the vehicle to her to come here. And once I asked Madam Jayant why you should come and stay here in Barshi. So she shared me few years ago Mr. Sopal told me that you madam come and stay here, I will look after you, everything for you. So why I was telling you why madam there is a very big attention between Barshi and madam. So leader like Philip Sopal is here and knows the people and that's why this going on and due to her and Dr. Shankar's introduction is due to Madam Jayant here for us and we have a good collaboration with International Agency for Research on Cancer and we got this cervical cancer prevention program. The results were published in International Journal of Cancer and then we got this cervical cancer vaccination program and Barshi is the one of the major part in that study. These are the 9 center study and Barshi is one of the biggest study here. And now the world is watching for the result from this study. The single dose is efficient for these new girls to eliminate the cervical cancer. And we have always the support from the managing council of the society. So Madam Jayant has expressed her gratefulness to all of you and all managing directors. Thank you.
आणि कस्तुरी जयंत मॅम ज्या वेळेला काही ऑफिशियल मीटिंग्स असतात त्यावेळेला मला डॉक्टर आनंद सरांनी सांगितलं की त्या ऑनलाईन असतात आणि आपल्या सोबत असतात. अशा कस्तुरी जयंत मॅम यांना उदंड आयुष्य लाभू देत असेच यानंतर सत्यनारायण झमोर सर यांचा सत्कार डॉक्टर आनंद सोपल यांनी करावा अशी मी त्यांना विनंती करते. यानंतर शुक्ला साहेबांचा सत्कार आनंद सोपल यांनी करावा अशी मी त्यांना विनंती करते. प्रशासकीय अधिकारी का निंगरे सर करते.
Now I request Dr.Senkarnarayan sir to say few words.
Before he
शंकर सरांचा आपण मनापासून हार्टली आपण त्यांचा आणि मॅडमचा आपण सत्कार केला. त्यांना खूप लाईफ टाईम अचीवमेंट अवॉर्ड मिळालं. त्या अवॉर्डच्या ह्याच्यात आणखीन एक साखरेत काय आणखीन साखर वाढली किंवा काय म्हणतात तसं झालंय. काल डॉक्टर पार्था बसूंचा एक मेल आला होता संध्याकाळी की जे काही कॅन्सर हॉस्पिटल आता हे प्रोजेक्ट आपण रन करतोय इतक्या दिवस आपण काय त्याच्या बाबतीत कधी कन्सिडर केलं होतं. मागच्याला सोपल साहेब आम्ही सत्वनी अशी रिक्वेस्ट केली होती तर त्यांनी त्यांच्या येणाऱ्या बजेटमध्ये आम्ही प्रोव्हिजन करू की 5% कॅन्सर हॉस्पिटलला सुद्धा त्या ग्रँडमधून त्याबद्दल सर्व टीमचं आणि हॉस्पिटलतर्फे मी आभार मानतो.
Dear Dr. Nene, Mrs. Jayant in absentia, Mrs. Shukla, Mrs. Satyanarayan, all the managing council members, Dr. Malavi, Mr. Jawan, and Dr. Sobal, and all colleagues, compatriots. I am so humbled by the warm reception that you have accorded, and it brings back very fond memories of Barshi, and it is very nostalgic for me. In fact, at the outset, I would like to express the gratitude of the WHO's International Agency for Research on Cancer and myself for the untiring support that, sir, you have given to our programs, and the facilitation provided by late Dr. Nene, Mrs. Jayant, Dr. Malavi, Mr. Jawan, and all of you, and Mr. Sukla, managing council members, the administration, and Barshi municipality as such, the districts of Solapur, Usmanabad, and all those areas, and the excellent rapport that you have built with the civic authorities and everything. It is exemplary, and I would like to thank you. In fact, I do not know how many of you appreciate that how much Barshi is appreciated across the world. I think in medicine there are two top journals. One is the New England Journal of Medicine. That's the #1 international medical journal. The second important medical journal is the Lancet. I think Barshi is the only center which has published articles in the New England Journal of Medicine and in the Lancet. To get a paper published in New England Journal of Medicine, it is a Herculean task. And they really rigorously evaluate the study, and then only they approve for publication. So that way, once that comes there, nobody asks any question. And the second thing is, the sort of results that you have documented is driving public health policies of governments across the world. For example, WHO has now accepted HPV testing is the best cervical cancer screening method based on the result documented by Barshi in New England Journal of Medicine. The WHO changed over from a 3-dose human papillomaviral vaccination policy to a 2-dose policy based on the results documented by the Barshi Center for Quadrennial Vaccine. Now they are anxiously waiting for the results of the single dose from this place to change the policy of 2 doses with 1 dose. Okay. So not very many institutions in Asia can claim this type of global recognition. And 10 years back, WHO in their World Cancer Report devoted 1 page and they said, Barshi is the role model for establishing cancer centers in African countries. It is widely known. You go to internet and you put Barshi. I think 90% of the information is about the cancer hospital in Barshi. And that has come mainly because your efforts, the untiring support which has been given by people like Dr. Sopal sir, Dr. Nene, and the ideologue behind the whole thing, Mrs. Jayant, Dr. Malavi, Mr. Jawan, Mr. Sukla, and your managing council, and your dedicated efforts. The Barshi staff are highly disciplined and well trained. You wouldn't believe that Barshi has now trained people from Algeria, Morocco, from Gabon, from Uganda, from Chile, from Colombia, Latin America, South America, from Colombia, from Thailand, from Myanmar, from Bangladesh, from Nepal, all to Sri Lanka, yeah, Burkina Faso, all those places, Guinea, all those places. In fact, we have trained French-speaking people, Spanish-speaking people in English and bringing Spanish teachers and French teachers over here. So you have several laurels, and that is because of your sincere efforts. And this current vaccine project will continue at least for the next 10 years because the Gates Foundation is very happy with the way the project is being run from here. And they certified long back their appreciation. Mr. Godan Perkin came here personally from Gates Foundation and issued a certificate in this year growth. And they are very keen to support this. And WHO will bring in new projects like breast cancer, early detection and all those things. So there is a scope for continuing support for this center for several years to come, and you deserve it. And at the bottom line, it is the untiring support which has been provided by all segments of this hospital. The chairperson, the director, the medical superintendents, the hospital per se, the managing council, and the staff. This is an excellent collaboration, and this sort of collaboration is the one result that we are getting. So I wanted to emphasize this. I am very proud that I came here and we had the opportunity to work with you, because I have worked in more than 100 countries with several people. From Portuguese-speaking countries, Spanish-speaking countries, Swahili-speaking countries, China, and all those places. Barshi is very unique because highly focused, and that comes from, the ideology which has been put behind by Mrs. Jayant and fully supported by Swapilsa. In fact, to his record, I should tell you, he has never tried to influence us with his personal decision. Whenever we have a problem, we have gone to him and said, this is it. But he has never tried to intervene. And he has given us free hand. And that is what helped us. And we request your support. Mr. Shukla, your support is very critical. And I was also telling, we should be replacing our workers with Gurkha now. Our workers are getting more, and we should maintain, we should change our fleet with Gurkha. Are you displaying Gurkha here yet? Not yet. When will it is expected?
Next 2-3 months.
Next 2-3 months. So I was strongly recommending 5-door Gurkha. Yeah. So the sort of, please continue to give the same sort of support to Dr. Parthabasu and to the project, and the ease with which Dr. Malavi and Chauhan and others can function here. And I would particularly like to thank Dr. Malavi because we need a strong principal investigator. And Dr. Malavi may not take all these efforts. No, she is happily retired and can spend the time in Bombay, sort of with her friend circles and things like that. But she has taken this responsibility, being the principal investigator and looking after the project. And she has excellent rapport with Mrs. Jayant, and quite often I used to think they are sisters. Okay, and so our special thanks to you, and tell about Mr. Chauhan, you give him some task, he doesn't rest until it is delivered.
Yeah.
Once I remember, we had asked for an appointment to meet with Mr. Manmohan Singh, with our director. And several people from Barshi helped us. Madam Jagguduke, Sivraj Patel sir, Sunil Dutt sir. And Mr. Chauhan was the intermediary between the ministry and the PM's office. And the PM was supposed to meet us the previous day of the Indian budget. And they said, so Manmohan Singh has given us 20-minute appointment on the previous day of the budget. And I said, so how can they meet on the previous day? But the time will be given only at that time, close up to that time. So when finally they gave the time, evening 6 o'clock, we went to Manmohan Singh's house. And then his secretary called, who is this Mr. Chauhan? He has been pestering me from morning. When is the appointment time? When is the appointment? And I couldn't resist until, he made me rest, and only after I have given him the time. This is the truth. I wish I could record the whole thing. And then we went and saw Mr. Singh. And India became a participating state in IARC. So India contributes. And that happened mainly because of the rapport which was created by our colleagues here. I think you people played a major role in facilitating the political agenda, the political connections, which is very important, very, very important to execute an executive action. So I am saying this in several aspects. This is a very important project. I am not exaggerating a single thing here. This I want to emphasize. I am not saying this because Sokul sir is sitting there, so I want to please him. No, sir. This is an exact assessment, and your entire support is very important for us. The management council's entire support is very important. Mr. Shukla, you should facilitate many of our problems and find solutions and help us to move forward fast, because there are many new programs will be coming in, and it will have a complex interplay with existing programs and new programs. And it's good, finally we have a good medical officer who has joined, Dr. Soto, who comes with quite a bit of field experience. I was quite impressed with the field experience he has. And our program managers have evolved very nicely, Mare and all those people. And many of them have been trained abroad in good places. And there will be continuing training opportunities in good institutions once the corona epidemic is over. So it will be a symbiotic relationship. Already this year we are being now to conduct 2 training courses. One of the training courses is the sort of Portuguese-speaking people from Timor-Leste, Eastern Timor, which is close to Africa, Australia, to come here and then have an intensive program. This is by the WHO. So we haven't answered them yet because of corona uncertainty. Once we have, then we have other issues. So maybe you may be very busy, sir, and we really appreciate the time that you have taken, all of you have taken to come here. And I personally thank you for the kind felicitation you all offered, and it makes me so humble. And it's our emotional moments for me. And as you age, you become old. Now I'm 70 years old, and I came here when I was 45. Time has quickly passed, but it's so nice to see the program shaping up, going like this in a growth trajectory. And we overcame all the challenges of corona. We were able to continue to employ our staff. We could bring the funds. We used the time very usefully to upgrade our things and things like that. So every way it is a win-win situation. And thank you very much. And I thank you all for your kindness, for your support, for your cooperation, and for your goodwill. Thank you very much.
डॉक्टर शंकर सरांनी अतिशय सोप्या भाषेत आपल्याला की संस्थेचा जो काही सपोर्ट आहे त्या सपोर्टमुळे आज बार्शीचं नाव जगाच्या नकाशावर पसरलेलं आहे. बार्शी हॉस्पिटल एक युनिक हॉस्पिटल आहे की आफ्रिकन कंट्रीजमध्ये जर हॉस्पिटल करायचं असेल तर बार्शीसारखं मॉडेल एक त्याच्यामध्ये उदाहरण म्हणून ते घेऊ शकतात. 2 जगप्रसिद्ध जर्नल आहेत, इंटरनॅशनल जर्नल ऑन कॅन्सर आणि लान्सेट. या 2 जर्नलमध्ये बार्शीसारख्या ठिकाणचे शोध निबंध तिथं प्रसिद्ध झालेले आहेत. तसे बार्शीनं आपल्या इथनं 30 शोध निबंध आपण प्रसिद्ध केले आहेत, पण हे 2 जे महत्त्वाचे जर्नल आहेत त्याच्यामध्ये आपले बार्शी सेंटरचे रिझल्ट पब्लिश झाले आहेत. CCPनं दाखवून दिलं की HPV ही टेस्ट जी आहे ते जगमान्य टेस्ट आता झालेली आहे की ज्याच्यामुळे कॅन्सर इलिमिनेशनसाठी मदत होणार आहे. त्याच्यानंतर दुसरं जे वॅक्सिनेशनचा प्रोग्राम आपण सुरू केला की त्याच्यामध्ये पहिल्यांदा 3 डोस देत होते, नंतर 2 डोस द्यावे अशी जगाची त्याच्यामध्ये सूचना आहे. परंतु आता 2 डोस नंतर सुद्धा सिंगल डोस त्याच्यावर संशोधन चालू आहे आणि ते सुद्धा बार्शी सारख्या सेंटरमधून जगाला दिशा दाखवणार आहे. आणि हे सगळं शक्य आहे की मॅनेजिंग काउन्सिलचा जो चांगला कंटिन्युअस सपोर्ट आहे त्या सपोर्टमुळे हे सगळं यशस्वी झालेलं आहे. तर त्यांनी जे काही 2 शब्द सांगितले आपल्याला त्याबद्दल मी सगळ्यांच्या वतीनं त्यांचा आभार मानतो. आणि आपल्या संस्थेचे कार्याध्यक्ष चेअरमन माननीय श्री दिलीपरावजी सोपल साहेब यांना विनंती करतो की त्यांनी 2 शब्द.
सन्माननीय श्री शंकर नारायण जी, सन्माननीय मालवी मॅडम, संस्थेचे सचिव सन्माननीय सत्यनारायणजी, संस्थेचे खजिनदार सन्माननीय शुक्लाजी, या प्रोजेक्टकडं पूर्वीपासून ज्यांनी घरचं काम समजून लक्ष दिलं ते माझे मित्र आणि या संस्थेचे सुरुवातीपासूनचे डॉक्टर नेने साहेबांचे राईट हँड मदन सिंहजी चव्हाण, विचारक मनीष चव्हाण, डॉक्टर सोपल साहेब, श्री परांजपे साहेब, उपस्थित सर्व या युनिटमध्ये काम करणारे बंधू भगिनी, आज आपल्या या प्रोजेक्टमध्ये पूर्वीपासून सुरू करण्यापासून आज इथपर्यंत जी प्रगती झालेली आहे त्या प्रगतीमध्ये डॉक्टर शंकरनारायण, कैलासवासी डॉक्टर नेने, आपल्या सगळ्यांच्या मार्गदर्शिका जयंत मॅडम, मालवी मॅडम यांचं खूप महत्त्वाचं योगदान आहे. त्यामुळंच हे यश मिळालं. आणि त्याचबरोबर या प्रोजेक्टमध्ये काम करणारे सर्वच कर्मचारी आणि त्यांना मार्गदर्शन करणारे मदन चव्हाण, इंदिरे, डॉक्टर सोपत यांच्यामुळेच हे जी काही प्रगती झालेली आहे त्याचं खरंच श्रेय हे या सगळ्या स्टाफ त्यांना सपोर्ट करणारे आणि वेळोवेळी फक्त याच्यातच ज्यांनी भाग घेतला ते डॉक्टर नेने साहेब. त्यामुळं बार्शीचं नाव विशेषतः WHO ह्या 3 त्रिमूर्तीमुळं डॉक्टर शंकरनारायण, मालवी आणि जयंत मॅडम यांच्यामुळंच हे नाव आणि तुमच्यामुळं हे होऊ शकलेलं. हे सगळं श्रेय खरं म्हणजे या ठिकाणी काम करणाऱ्या सगळ्या तुम्हा मंडळीचं आहे. आम्ही फक्त सपोर्टर आहोत, विश्वस्त आणि ते तुम्ही ज्या उत्साहानं काम करता, डॉक्टर शंकर नारायण WHO ज्या आपुलकीनं मदत करतात, ह्या सगळ्याचं एक परिणाम म्हणून या हॉस्पिटलचं नाव हे आज या उंचीवर गेलेलं आहे. आणि त्यांच्या सगळ्या पॉलिसीला आम्ही, कारण आम्ही सगळे नॉन मेडिकल लोक, डॉक्टर नेहमी सोडले, वेर ऑल नॉन मेडिकल. आय एम ॲडव्होकेट, इज बिझनेसमॅन, मिस्टर शुक्ला इंजीनियर एंड बिजनेसमैन. यहाँ कोई भी डॉक्टर ने छोड़ के, और डॉक्टर कश्यप भी एक अन्ना थे, वो छोड़ के सब नॉन मेडिकल पर्सन. इसलिए जो मेडिकल पर्सन्स हैं, इसमें काम करने वाले, उनके पीछे रहना और उनको सपोर्ट करना, यही हमारा काम है. और आज तक हमने इसी तरह से हमने ये काम किया है. और हमको बहुत खुशी है आज सबके लिए कि आपको लाइफ टाइम अचीवमेंट अवार्ड मिला है. और डॉक्टर जयंत जो हमेशा 10-15 बरस यहाँ आती थी, और मेरी उनकी मुलाकात सिद्धेश्वर एक्सप्रेस में हमेशा होती थी, और उनसे पता चलता था कि हॉस्पिटल का ये प्रोजेक्ट का काम कैसे चल रहा है. डॉक्टर मालवीय, इनका भी बहुत बड़ा कंट्रीब्यूशन है ये सब आगे ले जाने में. मैं उनका भी बहुत बहुत दिलो जान से आभारी हूँ. आपका भी आभारी हूँ. आप जो भी प्रोजेक्ट यहाँ लाएंगे, we will blindly support you. और आपको शुभेच्छा देके मेरे 2 शब्द खत्म करते हैं.
धन्यवाद. डॉक्टर शंकर सरांना या सोसायटीकडूनही आणि आमच्या बार्शीकरांकडून खूप खूप शुभेच्छा. मालवी मॅम सादर करणार, आणि कस्तुरी मॅम, तुम्ही आम्हाला सगळ्यांना बघताय, तुमच्या कस्तुरीचा आशीर्वाद रूपी सुगंध असाच पसरू दे, आम्हाला मार्गदर्शन करू दे आणि उदंड आयुष्य लाभू दे. यानंतर मोठा थँक्ससाठी मी डॉक्टर आनंद चोपल यांना विनंती करते.
On behalf of Nargis Datta Memorial Cancer Hospital, I thank Mr. Dilip Sopal, Dr. Senkarnarayan. I thank Dr. Senkarnarayan because this project is running very smoothly last 20 years, and he given assurance that next 10 years this project will be running, and the training programs and other projects that will be given to this project henceforth. So I personally thank him and from the hospital. I also thank Dr. Malavi for her sincere effort for our cytology lab. Because of that, the early detection services which are going in the Osmanabad district and Solapur district, because of that accreditation of the lab which is only in the Maharashtra, all private doctors refer their cases to our lab. And we are proud that under the guidance of Dr. Malavi, the lab is running very good, and we are most probably expanding our district, maybe Aurangabad, Beed, Nanded, Latur, all this. I thank Dr. Malavi. Then I thank Mr. Jawar sir, because he always asks what is going on in the project, what is going on in the hospital. He always asks to look after some medical problems which are going in the hospital. I personally thank him for his suggestion. I thank Mr. Shukla ji for innovative and whatever may be machinery required for our hospital, going from linear accelerator to our anesthesia machines, our building, our bunkers. He personally interested in that, and he also always look after that. I personally thank Mr. Shukla. Then I thank our project in charge, Sonal sir, because of his last 25 years devotion to the hospital and project. And lastly, I thank Mr. Hindre, Administrative Officer, Honours Pay, Manish Chavan, and all our dedicated staff to running this project smoothly for last 20 years. Thank you.
Hospital in Barshi has been working to prevent and detect early cancer or early precancerous cases of the uterine cervix, and this cervical cancer is very common in rural India. So we are working here for many years and having several projects to work on the women here to eliminate cervical cancer. And now the latest thing is that we have introduced vaccination. All young girls should take it because before the cancer starts, before it forms, we can prevent cancer from occurring. So I would advise all young girls to take the vaccination. Thank you.